Thank you for choosing CryoDose TA from Nuance Medical, an instant onset vapocoolant anesthetic spray chosen by thousands of clinics throughout the U.S. today. CryoDose TA has been used for over 10 million patient days and is the safest topical anesthetic for long-term use in the marketplace. CryoDose TA is FDA-cleared to manage pain associated with regular cannulation and needle sticks. The anesthetic effect is achieved through rapid evaporation, cooling the skin for 30 to 60 seconds. Let's walk through how to use CryoDose TA. First, you will collect your supplies and prepare the cannulation site as you always do. Next, you will prep the access sites according to your local policies and procedures. Then, you will spray the CryoDose TA onto the site. To use, hold the can 3 to 7 inches away from the access site and spray for approximately 4 to 10 seconds. 1, 2, 3, 4. Stop spraying immediately if the skin turns white. Do not continue to spray after whiteness is observed. Lastly, perform cannulation as normal. We are committed to helping you provide the very best care and most comfortable dialysis experience for your patients. For more information or to contact us, please visit cryodoseta.com.